Hello, my name's Brandon. I'll be your nurse for the evening. Wash my hands real quick. Alright, can you tell me your name and date of birth?
Catherine Samuelson, 9/20/96.
Awesome. And can you tell me where you are?
I'm in Sarah's apartment.
Alright, why are you here today?
For my head-to-toe assessment.
Alright, and what's today's date?
The 25th of October.
Awesome. Alright, and with that assessment, we can tell that the patient is oriented ×3, and we can tell that she's coherent. Her voice is normal, and so everything there checks out. Alright, Katie, I'm going to start out by palpating and inspecting your scalp for any masses or lesions. Alright, you can lean back. Alright, no masses or lesions were detected, and the hair is clean and dry. Alright, and the face color and skin is expected for the racial color. And look at me real quick. Alright, your eyebrows and eyelashes are equal bilaterally, and hair growth is as expected. Alright, I'm going to have you look up for me, okay? Alright, good. Now look down. Awesome. Alright, conjunctiva are red, or pink rather, and moist. Alright, I'm going to have you look at the back wall real quick, okay? I'm going to shine this light in your eye. Alright, good. Alright, and one more time. Keep looking at the back wall. Look at my finger. Alright, good. And with that assessment, we can tell that the pupils are equal, round. You okay?
Yeah.
Alright. We can tell that the pupils are equal, round, and reactive to light and accommodation. Alright, and now I'm just going to test the ears real quick. No masses or lesions of any kind, and at the 10-degree angle from the eyes. Alright, now we're going to test the nose with the airway. Breathe in for me. Good. Breathe in for me. Good. Alright, and equal airflow through both nostrils. Alright, and now I'm going to have you open your mouth for me, okay? Alright. Alright, move your tongue to the left, to the right, up, and down. Alright, all the teeth are intact, and the oral mucosa is pink and moist. Alright, and now I'm going to check your temporal pulse, okay? Alright, temporal pulse is equal bilaterally. Alright, I'm going to check your carotid pulse real quick. Lift your head up a little bit. Alright. Alright, good. And now I'm going to check your lymph nodes, okay? Alright, lean forward a little bit for me, just your head. Your hair. Alright, good. Jaw. Alright, good. No enlarged lymph nodes were noted. And now we will also check the lymph nodes down here. I'm going to have you shrug your shoulders for me. Alright, no lymph nodes detected down there either. Alright, and now we're going to move on to the chest. We're going to start by oscillating the heart sounds. Now I'm going to start with the diaphragm of my stethoscope. Before we do this, I'm actually going to check the carotids for bruit as well. And that's going to be with the bell. Alright, right side is negative. Left side is negative, no bruise detected. Now we can move on to the chest. Alright, everything was normal. I'm going to switch to the bell so we can listen for any murmurs. Alright, no bruise were detected. Alright, and now what I'm going to do is I'm going to listen to your apical pulse. And I'm going to count your respiratory rate, okay? Alright, if I could put my stethoscope on. Alright, let me use my face watch to count. and I got an apical pulse of 64 and a respiratory pulse or rate of 15. All right, and now I'm going to listen to your lung fields. I do that with the diaphragm of my stethoscope. We're going to start with the front. And before we do this, we're actually going to palpate the chest to see if there's any masses or lesions we didn't know about. All right, now we can move on to the lungs. All right, just breathe normally for me, okay? That's okay. All right, lung fields on the anterior side are all clear with no wheezing or stridor. All right, sit up for me. All right, if you could sit at the edge of the bed with your legs hanging off. I'm gonna move your hair out of the way, okay? All right, before we start the auscultation, we're gonna check for chest expansion. All right, let me take a deep breath for me. All right. One more time. All right, equal chest expansion bilaterally. All right, we're going to go ahead and auscultate the lung sounds. All right, posterior breath sounds were all equal and with no wheezing or stridor also bilaterally. All right, now we're going to check the lateral sides. All right, just keep your hands on your knees for me. All right, just breathe normal. All right, lung sounds were clear and no wheezing or stridor was present bilaterally. All right, I'm gonna go ahead and have you lay back down for me. All right, can you lift up your shirt for me just to show your abdomen? All right, and just by visual inspection, we can see that the abdomen is the right color for the skin tone, for the racial tone, and it is equal bilaterally and round. And we're going to go ahead and auscultate it now. We're going to start, we have 4 quadrants, I'm going to start in the lower right. right, and bowel sounds were equal throughout each quadrant, and they're all active and present. All right, and now we're going to go ahead and check for the abdominal aorta, see if we can hear any bruit. And we're also going to, while we're there, we're going to check the renal arteries and the iliac arteries. And we're going to be doing that with the bellows stethoscope. All right, left renal artery. Right renal artery. Right iliac artery. Left iliac artery. All right, no bruise or venous hum was detected in any of the locations. All right, you can put your shirt down for me. Do you have any tenderness in your abdomen?
No.
Okay. We're going to go ahead and start with a light palpation. You okay? Okay. All right. Any tenderness anywhere so far? Okay, good. All right, now we're going to go a little deeper palpation now. Still no tenderness?
No.
Okay. All right, now that we are done with the abdomen, we will move on to the arm strength. So can I see your arms real quick? All right, squeeze my hand. All right, strength is equal bilaterally, and since we have the fingers, we're going to go ahead and inspect them. We're going to inspect the capillary refill, and all the fingers are under 3 seconds, and the nail beds are all pink and round and not clubbing, and 160-degree nail beds. All right, and now I'm just going to go ahead and check your pulse real quick, or your radial pulse, that is. All right, that's equal bilaterally. You can just rest your hands. I'm going to check for edema or any masses in your arms. Just these big guns right here. All right. All right, and that's everything for the top half for now. We're going to move down to the feet. All right, and if in a real hospital situation, we would have the toenails, we would take the nail polish off so that we'd be able to check for capillary refill. And we would also be checking for clubbing like we did in the fingers. And we would also look for the redness, but we can't with the polish. And let's see. Yep, no clubbing, and they're round. And now, before we move up the leg, we're going to check for the skin turgor to check for elasticity. And this is a good chance to go ahead and check the hands too, as well, just to make sure. All right, skin turgor is good there as well. All right, we're going to go ahead and check the posterior tibial pulse. All right, and that is equal bilaterally. Now we're going to check the pulse on the top as well. Dorsoplantar pulse. All right, that is equal and bilateral as well. And now we're going to check the legs for any edema or masses. All right, no edema or masses present. All right, now we're going to move on to a sensitivity assessment. All right, Katie, we're going to do a quick little assessment. I want you to tell me if the feeling is soft, blunt, or sharp. This is going to be soft. This is going to be blunt. And that'll be sharp. Understand?
Okay.
Okay, I'm going to have you close your eyes too, okay?
Okay.
All right.
Soft.
All right.
Sharp. Dull.
Alright.
Soft. Sharp.
Alright. Sensory is all in good shape. Alright, and while I'm thinking about it, before we forget, I'm gonna have you close your eyes. I'm gonna tell, and I want you to tell me when you hear it. My fingers, okay?
You hear it. You hear it.
Alright, good. Don't want to forget that. Alright, and I believe that's everything. So we're gonna go ahead and start working on our range of motions. In just a second, we are going to, so we don't have to keep getting up and down, we're gonna go ahead and perform this Holmes test. I want you to let me know if there's any pain, okay?
Okay.
Any pain?
No.
Good. Any pain?
No.
Good. Alright, and if there was, that would be possibility of a DVT, and before ambulating the patient we would look more into that, so we wouldn't want to dislodge a thrombus. Alright, I want you to go ahead and sit on the side of the bed for me. Alright, we're going to start with your shoulders, okay? Alright, I want you to lift them up. Alright, good. And put them down. I want you one behind your back, and the other one behind your head, behind your other. Okay. And then across. Across. Good. Range of motion in the shoulders is full, or good, either way. Alright, now I want to see your elbows. Alright, now out. Now in one more time. Good. Range of motion in the elbows is good. Now we're going to work on the wrist. Down, up, out, in, circle. Alright, range of motion in the wrist is good as well. Alright, hands out again, fingers down, fingers up, and fingers out, in, and close your fist. Now open your hands. Alright, range of motion in the fingers is full as well. Alright, we're going to go ahead and do the ankles since we're sitting here. Can you plant both your feet in the ground? Alright, now up, now out, and in, and circles. Alright, full range of motion in the ankles. Alright, and I want you to put your heel on your knee and run it down your shin. Alright, good, and your other one. Alright, good. And now we're going to stand up and we're going to do some more for your hips and knees, okay?
Okay.
Alright, and now I want you to keep your knees straight. I want you to kick forward, then back, and then to the side. Alright, same thing. The other leg, kick forward, kick back, to the side. Alright, and that shows that the hip range of motion is good as well. Alright, and now we're going to do the knees. I want you to bend your leg back, and your other leg. I want you to bring your knee up to your chest as much as you can, standing up. And your other one. Alright, good. And can you put your leg up here? Alright, and your other leg. Alright, and I know we just did this, but I want you to stand on your one foot for a second. Alright, and your other foot. Alright. I'm going to have you walk towards that door, and I'll tell you when to walk back. Alright, patient has a normal gait, and I want you to heel toe back to where we were. Alright, and still showing a normal gait. And the ones we did earlier, that showed range of motion in the knees. Alright, and so we can go ahead and sit down. Alright, go ahead and lay down for me. I'm just kidding. I would like you to stand up before we get you comfortable. One last thing. Alright, I want you to put your feet together, and hands to your side. I want you to close your eyes and just stand there for a few seconds. I'll let you know. Alright, that's good. And that's a Romberg test, and did good. So, that is everything for this assessment. Thank you, Kate.